Hello there, welcome to Cell Biology. My name is Junico Maynard and today we'll be discussing hemolytic anemia. It's a disorder which results in the destruction of red blood cells faster than they can be made. This is known as hemolysis. There is an increase in hemoglobin catabolism, decrease in the levels of hemoglobin, and a remarkable increase in efforts of bone marrow products regeneration. Research has proven that the glycolytic pathway is the metabolic pathway changed or damaged by hemolytic anemia. There are remarkable impacts on organs and organ systems from hemolytic anemia, which may include tissue hypoxia, muscle pain, ischemia, and thrombic complications. Complications in the kidneys can result in decrease in kidney function. Both liver disease and neurological deficits are also present in some cases. This can result in the blood cells being unable to bring enough oxygen to all tissues and organs. Heritability. Hemolytic anemia is a disease that can be both inherited and it can also be influenced by epigenetic factors. Inherited hemolytic anemia affects the next generation when parents who have the gene for hemolytic anemia reproduce and pass the genes for the condition on to their children. Two common causes of this type of anemia are sickle cell anemia and thalassemia. These conditions produce red blood cells that don't live as long as normal red blood cells. The risk for hemolytic anemia is associated with other diseases such as malaria, Rocky Mountain spotted fever, Haemophilus influenza disease, HIV, blood cancers, autoimmune disorders such as lupus, and certain tumors. To continue, the inheritance pattern of hemolytic anemia is dependent on gene. What does this mean? So autosomal recessive. Two copies of an abnormal gene must be present in order for the disease or trait to develop. Autosomal dominant. Only one copy of a normal gene must be present in order for the genetic trait to be passed from one parent to child. Or this may also be an X-linked condition, which is caused by a non-working X chromosome, and this may only manifest in mostly males. To continue with heredity, the genes involved in inherited hemolytic anemia includes sickle cell, which is caused by a mutation in the HBB gene. We also have thalassemia, which is a mutation in the HbA1 and HbA2 genes. And there is hereditary spectrocytosis, hereditary electrocytosis. Genetic testing is recommended when the initial test results for hemolytic anemia do not explain the clinical presentation or mode of inheritance. So, to continue, inherited hemolytic anemia is caused by mutations, as I would have just mentioned, for sickle cell disease. So this is a genetic disorder, as I mentioned, caused by a mutation in both copies of a person's HBB gene. This mutation is a gene substitution. However, for thalassemia, it is either caused by a deletion or mutations in the goblin genes. There is a harmful genetic change in the HbA1 and HbA2 gene. However, a tetranucleotide deletion in the ANK1 gene causes hereditary spectrocytosis. Now we'll move on to symptoms of hemolytic anemia. Each person's symptoms may vary. Symptoms may include abnormal paleness or lack of color of the skin, yellowish skin, eyes, mouth. This is known as jaundice. We have dark colored urine, which may be due to the destructed red blood cells being passed to the kidney, out to the urine. There are also risks for fever, weakness, dizziness, confusion, inability to handle physical activity, an enlarged spleen and liver, increased heart rate known as tachycardia, and sometimes an heart murmur. In continuation, in the diagnosis of hemolytic anemia, it may be diagnosed during routine checkups. A healthcare provider may diagnose the disease based on symptoms presented, which I would have previously mentioned, or sometimes based off of a person's medical history, and a physical exam may be done. Tests may be ordered to aid in diagnosis. These tests may include a complete blood count known as a CBC. If the CBC test identifies that you have anemia, other blood tests would be taken to find out the type of anemia and the degree of seriousness. Urine tests to check for hemoglobin, which is a protein in red blood cells, and iron. As I mentioned earlier, this can result in the darkening of the urine in the symptoms. Also, a bone marrow aspiration or a biopsy to check the number, size, and maturity of blood cells or abnormal cells may be done. To continue on to treatments, the treatment for hemolytic anemia will vary depending on the cause of the illness. Treatment may include blood transfusion, corticosteroid medicines, treatment to strengthen your immune system using intravenous immune globulin. We also have, in more severe cases, the following treatments may be needed. So surgery to remove the spleen or medicines to reduce the strength of your immune system. This is known as immunosuppressive therapy. To continue, this is how allied health practitioners such as dietitians, dialysis technologists, and physical therapists can help reduce the suffering of the patient. So there is the watch and wait method, which means being aware and monitoring your symptoms and blood work for any changes. There is also supportive care by treating your symptoms, such as red blood cell transfusions, erythrocytosis stimulating agents, which is an admin hormone given by injection to raise blood cell counts, medications, and iron supplements. A good nutrition is very important to also prevent anemia. So this may include eating a balanced diet, which can prevent iron deficiencies, having a good source of iron in foods that improve iron absorption. Foods with vitamin C can increase iron absorption as well. In continuation, we move on to preventatives. However, there are currently no preventative technologies for inherited hemolytic anemia, but for the exception for glucose 6-phosphate dehydrogenase deficiency, if a person is born with G6PD deficiency, substances that may trigger the condition can be avoided, such as fava beans, naphthalene, and certain medicines. Moreover, there are preventative technologies for some forms of acquired hemolytic anemia, such as carefully matching blood types between the blood donor and the recipient. Conclusively, the outlook for hemolytic anemia. Based on a research article by Kathleen Baldwin and others, it is evident that there is active research being conducted about the disease, diagnosis of the type of hemolytic anemia, and management options available for several categories of hemolytic anemia. So, an insight story to close off. Myself, Juniko Maynard, I am also a carrier of the sickle cell trait, which falls under the category of hemolytic anemia. So hopefully the future looks brighter for those who are also suffering from the disease of hemolytic anemia, and those who are carriers like myself who bear some of the symptoms that falls with this disease. So this is the end of my presentation. Thank you so much for staying along, and It was nice having you. The end.